Is Falls Prevention Month, and health officials say that's important because of the scope of the problem in the Badger State. And joining us this morning from Gunderson Health System is Erica Kane. Erica, thanks for waking up with us this morning.
Good morning. Thank you for having me.
Talking about the scope of the problem of falling, especially with older adults, how bad is it in Wisconsin, and why do we think it's so much higher here than in the rest of the country?
Well, Wisconsin does lead the country in falls-related death, and unfortunately, I really can't give a solid answer on why that might be, but the important thing to keep in mind is really that falls are very preventable, and they're not a normal part of aging.
Yeah, that's interesting to say, because it seems like as people age, you might think, oh, that might be just a challenge that comes with getting a little bit older, but why is it so important that they know that it's not just a normal part of aging?
Well, there's really so many things that we can do to prevent falls, which is why it's important to keep in mind that it isn't a normal part of aging. There's lots of modifications people might consider making in their own homes to make their homes safer. Just simple things like thinking about removing clutter, making sure that there's no cords that might be a tripping hazard. Also, talking to your doctor is really very important. Thinking about what medications you might be on that could possibly increase your risk for fall, or possibly some vision problems that you might be experiencing that could increase risk for fall.
And now, talking about preventing it, is this something that people can be looking at doing now? At our age, young people can be looking at as far as their overall health, maybe preventing falls down the road.
Well, you might have heard the phrase, if you don't use it, you lose it, and that's totally true when it comes to falls prevention. Really surprising, people might be surprised to know that you can build muscle strength and balance at any point in your life, and this is especially important as we age, so that we can maintain strength and balance and prevent falls. So definitely we can think about it younger ages, but the truth is that people 65 and older are at greater risk of fall.
Right, and Erica, Gunderson has a new program out this year to kind of address that need, and maybe some people can get involved in that. Can you tell us a little bit about that?
Sure, we're very excited to offer the Stepping On program. Stepping On is a 7-week program, and it's offered really for anyone who has a fear of falling, but recommended for someone who might be 65 years of age or older, or has some other risk factors like I talked about, like medication that they take or vision problems they might have. And the program is really unique because we have the opportunity to bring in experts throughout Gunderson and experts throughout our community to really talk about those key messages that can help prevent falls.
Great.
And the next session for Stepping On is coming up, I believe, September 23rd. Correct me if I'm wrong there, Erica.
That's absolutely right. Wednesday, September 23rd.
All right.
It's a 7-week program, so.
Yeah.
7 weeks, great.
Thank you so much for joining us this morning and shedding some light on just how big of a problem falls are in this area.